Hello, Dr. Thomas here at Integrity Dental. Again, today discussing the topics that you want to hear more about. And today we're going to tackle the topic of gingivitis versus periodontitis, what the differences are, and what you should be aware of at home when you're concerned.
Dr. Thomas, what is gingivitis and is it different from periodontitis?
All right, the first question is, what is gingivitis, and is gingivitis different from periodontitis? The first answer is yes, it's different than periodontitis. There's a big difference. Gingivitis is the initial stages of gum disease. Many people have some form of gingivitis. Even in the healthiest of mouths, I guarantee you, I myself have had gingivitis at different times in my life. Gingivitis is inflammation and maybe a slight bacterial infection of the gums on the surface and slightly below the surface, but in an area that is usually able to be cleared up by a patient at home with the typical home hygiene process. So when you go to a dental office, if they're a good dental office, they're going to be measuring how deep the pockets are around your tooth, and they take a little probe and they go between the tooth and the gums and they see how far down that probe goes. They measure, and the measurements can be between 0 or 1, usually 1 and 10 to 12 millimeters deep. The deeper the probe goes in, the worse the health is around that tooth. Good and healthy gums, even gingivitis gums, are going to measure between 1 and 3 millimeters deep. If you get beyond 3 millimeters deep in that pocket, that gum that surrounds your tooth, that's when you have a change from gingivitis to what's considered periodontitis. So 4 millimeters and beyond is considered periodontitis, which is a much more serious disease process. That is gum infection, and that requires professional help to get rid of that sort of gum disease. You will not be able to adequately clean your teeth at home if you have periodontitis, because those pockets, when they get deeper than 3 millimeters, your toothbrush, your floss, your mouthwash, your toothpaste, we have peroxide gel now that you can wear in trays, and all sorts of different things to help clean your gums at home will not get down any deeper than 3 millimeters underneath that gum pocket to clean the side of the tooth. So deeper than 3 millimeters, that requires our hygienists and their special instruments to get down that far underneath the gums to clean the side of the tooth, to get rid of all the bad bacteria and get you back. Hopefully, we hope those gums kind of reattach and shrink back down to healthy numbers between 1 and 3 millimeters, and then back to maybe a gingivitis or good healthy gums category. So that's kind of the difference between the two.
What are the first symptoms of gingivitis?
What are the first symptoms of gingivitis? Big ones would be bad breath, bleeding gums, sore gums, and that's pretty much all that I can think of right now that you're going to notice at home.
How dangerous is gingivitis?
How dangerous is gingivitis? It's not good, okay? It's the warning sign that more serious stuff is coming. So if you are noticing those symptoms, bleeding gums, really sore gums, really bad breath, those are definitely things that you want to get checked out. Make sure that you're seeing your dentist, your dental provider, on a regular basis every 6 months. And that's typically why we see patients every 6 months. Unless you're in the gum disease category, which is not gingivitis, we see you more often in that category. But if we see you every 6 months, it is very unlikely that gingivitis will progress to the periodontitis gum disease category in that amount of time.
Can you have both gingivitis and periodontitis at the same time?
Can you have both gingivitis and periodontitis at the same time? The answer is yes. I would tell you that most people that have periodontitis also have gingivitis. Okay, gingivitis is again a dental infection of that top 3 millimeters of your gums. Periodontitis is infection of beyond 3 millimeters of that gum tissue. So not all people that have gingivitis have periodontitis, but that would be the beginning stages.
How do dentists treat gingivitis?
Dentists treat gingivitis with dental cleanings. A lot of times that gingivitis can be from bad home hygiene, inadequate home hygiene, like not doing it enough or thorough enough. It can be there because of not brushing enough, but sometimes we get tartar built up, even if you are brushing on a regular basis. And so that tartar or calcium buildup on our teeth, as it stays there, kind of acts like a splinter in your finger. And even if you're still brushing your teeth 2 times a day, like we recommend, you can still have gingivitis that happens because you've got all this tartar buildup that's retaining plaque that you're not going to get rid of. That calcium and tartar buildup you can't get rid of with a toothbrush. And again, that's why you need to see a dental health provider on a regular 6-month basis to make sure we get even the small amounts of that tartar buildup cleaned off your teeth, so it doesn't start to build and get bigger and bigger, because as it gets bigger, that is a very easy way for gingivitis to develop into periodontitis, which is much more expensive and much more difficult to get rid of.
How long does it take to cure gingivitis?
How long does it take to cure gingivitis? If you're cleaning regularly at home and you have a good professional dental cleaning, you can clear that up pretty quickly. I would say it's usually a range, but it could happen within 2 to 3 weeks.
When should I schedule a dental appointment if I suspect I may have gingivitis?
When should you schedule a dental appointment if you suspect you have gingivitis? The answer there is the sooner the better. It's a warning sign, like I said earlier, and you have no idea when that gingivitis crosses the barrier over into periodontitis. There's no way for you to control that other than continuing to clean as best you can at home. But I can't tell you how often I have seen normal, healthy patients that may have had gingivitis that have a bad event, life event. One would be COVID. We saw a lot of this with COVID, stressed out situations, kids during finals. A lot of times we'll see them that they just had gingivitis and they're just a little overdue for their cleaning, but it morphed into periodontitis in an aggressive form that was very uncomfortable because the COVID or the stress of finals or what have you put such a stress on their normal immune system to where that gingivitis got going into periodontitis very, very quickly. So sooner the better. So if you are concerned that you may have gingivitis or periodontitis, I would really recommend that you give us a call at Integrity Dental. Our cell phone, not our cell phone, but our office phone number is 719-545-2468. The sooner we get you evaluated and get you on our schedule to get your gums cleaned, the sooner we can get your gingivitis or periodontitis eradicated and get you back to good, healthy oral condition.